One of the most common medications used today is ibuprofen, and you've probably used this medication to help control your pain, fever, and possibly even for menstrual cramping. But you've likely also heard that ibuprofen is an anti-inflammatory. So today, we're going to talk about how this medication works and discuss how it might not control inflammation in the way that you think. Plus, we'll discuss if this medication can cause any harm or potential side effects. Maybe you've heard it could affect the liver, the stomach, and other organs throughout the body. So we're going to take a look at those organs by utilizing the bodies behind me, and again, talk about how this medication works and if it really controls inflammation. So let's jump into this anatomical and physiological awesomeness. So at some point, we're going to need to be able to take an ibuprofen tablet and get it into the various digestive system structures so that eventually the medication can get absorbed into the body and take its effect. But first, what is ibuprofen? Ibuprofen, commonly known as some other brand names like Advil or Motrin, is classified as a non-steroidal anti-inflammatory drug, or an NSAID. Now there are some steroidal anti-inflammatories, maybe you've heard of things like prednisone or dexamethasone, but those steroidal anti-inflammatories work a bit differently and are often more potent. And so we'll save those for a different video and focus on these non-steroidal anti-inflammatories like ibuprofen. Now, ibuprofen has some pretty common uses. It's commonly used as an analgesic, which is a pain reliever, an antipyretic, which is a fever reducer, and obviously as an anti-inflammatory. But again, as I teased in the intro, we're going to find that it may not be reducing inflammation like you think it is. But first, let's get it absorbed into the body and figure out what it's supposed to do, and then we can come back to some more details about inflammation as well as its potential side effects. Once you swallow ibuprofen, it will make it to the stomach and will start mixing with the gastric juices. Those gastric juices essentially include things like stomach acid, digestive enzymes, and even some mucus. Now, this is where the pill or the tablet is going to start to dissolve, and its active ingredients are going to be released. A small amount of it can get absorbed through the mucosal lining of the stomach that you can also see here and into the bloodstream, but the majority of it is still going to pass into the small intestine. And the small intestine is where the majority of the medication will be absorbed. The small intestine has tons and tons of blood vessels to absorb nutrients, or in this case, a medication. And this whole timeline of where absorption can start to take place is about 30 to 60 minutes. But once the medication is in the bloodstream, that means it can essentially circulate throughout the entire body. And this is where we get into how ibuprofen actually works. Ibuprofen works by inhibiting certain enzymes called cyclooxygenase 1 and cyclooxygenase 2, often abbreviated as COX-1 and COX-2. And what is important about these enzymes is that they synthesize substances called prostaglandins. Prostaglandins are extremely important to this discussion because prostaglandins are involved in multiple physiological processes throughout the body, which includes promoting inflammation. Prostaglandins are also involved in pain and essentially stimulate certain pain receptors. They're also involved with interacting with this structure in the central core of the brain called the hypothalamus. The hypothalamus performs multiple functions, but one of its roles is regulating body temperature, including the fever response. We also see prostaglandins influencing uterine contractions, say like during menstrual cramping, and so it can cause that smooth muscle in the uterus to contract. So you can see if we have a medication that inhibits or blocks the effects of these prostaglandins, you could help with period cramps, reduce fevers, inhibit pain, and potentially reduce inflammation. Now, I obviously emphasized potentially reduces inflammation because I've been teasing that ibuprofen may not reduce inflammation like you think it does. So let's address this now. As we've already learned, ibuprofen can help with pain, fevers, menstrual cramping, and potentially inflammation. However, the power of each of these effects are not equal, meaning a single dose of ibuprofen of like 400 to 600 milligrams for a headache, some muscle soreness, or even a fever kicks in pretty quickly within 30 to 60 minutes. And 1 to 2 doses is often enough to kick some people out of their pain. Then they get a good night's sleep, the underlying cause of the pain resolves, and they don't need any more of it. But for true anti-inflammatory benefits, this often requires higher prescription doses of like 600 to 800 milligrams and requires much more consistent use of like 2 to 3 times a day for up to 5 to 7 days in order to sustain prostaglandin suppression enough to have a significant reduction in inflammation. So for those of you experiencing pain due to the pain receptors being activated by prostaglandins, or even prostaglandins stimulating a short-lived fever, a couple of doses is all you might need. But the inflammatory response is so much more robust with multiple signaling molecules and white blood cells involved that it requires much more to really suppress it, or even a flat-out stronger anti-inflammatory like a steroidal anti-inflammatory such as prednisone. So a lot of you who just occasionally use ibuprofen once or twice to help you with your pain, it can work very well in many of those circumstances. But you are not really getting an anti-inflammatory benefit from using ibuprofen in that way. And you don't really need it if you're just wanting to manage some acute, mild to moderate pain. People who do utilize the anti-inflammatory power of ibuprofen are going to be those people who are utilizing it for more chronic conditions, maybe like arthritis, or maybe they choose to consistently use it for a week for a major ankle sprain or some other injury. So to be clear, it's not like ibuprofen doesn't provide an anti-inflammatory benefit, because it does. It just takes a bit more than people think in order to get there, like higher doses and more consistent use for multiple days at a time. Now, I'm assuming that most of you watching this video are interested in your health. And so let me quickly talk about an awesome tool that can give you many incredible health insights, and that is the Hume Health Body Pod. The Hume Health Body Pod is a clinical grade body analyzer and is much more than just a bathroom scale, and it gives you a lot more information than just your weight. The Body Pod uses bioelectrical impedance analysis to scan and deliver over 45 metrics, things like skeletal muscle mass, body fat percentage, hydration levels, and metabolic age, to name a few. And one of my favorite features is that it breaks that data down into regions so that you can see how much fat and muscle you are carrying in your limbs versus your trunk, and even compare right and left sides so that you could target any muscular imbalances during your workouts. Now, the Body Pod claims to be 98% accurate. And when I first started using the Body Pod, I was able to put that accuracy to the test because I actually had body composition tests done at a lab around the same time, and the results were nearly the same. So I've been using it for months now, and I've been logging consistent weigh-ins, syncing my sleep and workouts, and even setting milestone goals that I can track in the app. And as a bonus, the Body Pod is HSA and FSA eligible. So if you want to know more about your own anatomy, click the link in the description to check out the Body Pod, and use our coupon code, TheAnatomyLab, to get 20% off. Plus, that 20% discount also stacks on top of their current online sale for up to 50% off. So go ahead and start optimizing your health routine today. And now, let's get back to the side effects of ibuprofen. But what about the potential side effects of ibuprofen? Well, when it comes to side effects, we want to talk about a few different organs: the stomach, the kidneys, the heart and cardiovascular system, and we'll also address the liver. And this also comes back to those prostaglandins. Remember, we learned that the prostaglandins got involved in promoting pain, fevers, menstrual cramping, and even inflammation. But that's not all that the prostaglandins get involved in. In the stomach, the prostaglandins promote the secretion of mucus. And here, you are looking at the inside lining of the stomach called the tunica mucosa. And it's called the tunica mucosa because it secretes mucus, but it also secretes stomach acid. The reason your stomach doesn't eat itself alive with its own acid is because it has this protective coating of mucus between the acid and the lining of the stomach. So if you take a medication that inhibits the prostaglandins, that will inhibit the amount of mucus that is secreted by the stomach. So essentially, you would thin out that protective barrier of mucus, making the stomach more susceptible to damage from its own acid. So it's not the actual pill or tablet of ibuprofen that's causing direct irritation to the stomach. It's from the suppression of the prostaglandins, which therefore suppress the production of mucus. Now again, most people that take a short course or a few doses of ibuprofen are not typically going to have a major issue with the stomach. We get more concerned with this with people who are taking it for longer durations for more chronic conditions. However, people who have gastritis or a history of peptic ulcer disease or other stomach conditions will also want to be careful even with the shorter courses, or may want to choose a different medication altogether. But what about the kidneys? Well, here's a really cool frontal section of a kidney. Blood is constantly going into the kidneys in order to be filtered, and that blood will eventually be distributed to the outer portion of the kidney that I'm tracing with the probe here, called the renal cortex. And if we were to zoom in to the renal cortex, we would see these microscopic filtration structures called nephrons. And prostaglandins can have an effect on these structures, specifically the small blood vessels that take blood to these filtration units, the nephrons. Prostaglandins vasodilate the microscopic blood vessels of the nephron, which brings more blood flow into the kidney. However, if you suppress those prostaglandins with a medication like ibuprofen, that can cause those blood vessels to be in a more vasoconstricted state, therefore not allowing as much blood flow to go into the kidneys, and could potentially result in kidney damage. Again, at the expense of sounding like a little bit of a broken record, short courses of ibuprofen for people with healthy kidneys typically is not going to be a major problem. It is the longer, more chronic uses of this medication. Or if somebody already has kidney disease, this individual may want to avoid ibuprofen entirely. When I'm talking about pain management or fever reduction with my patients in the clinic, I'll often ask them about their kidney function, or we'll look at previous labs together to make sure they don't have any kidney issues in order to make sure that something like ibuprofen is not contraindicated as a potential medication that they could use. Now, I actually hesitated bringing up the side effects that ibuprofen can have on the cardiovascular system because it's a little more nuanced than the other side effects. But I think it's important to mention, so we'll do our best to work through some of these nuances. Prostaglandins help balance blood clotting and vessel tone. Ibuprofen can inhibit a prostaglandin called thromboxane that promotes clotting. So if you inhibit this particular prostaglandin, you can kind of get this mild blood thinning effect that can increase bleeding risk, and that's why surgeons will often tell their patients to discontinue ibuprofen prior to surgery. However, it also inhibits a different prostaglandin called prostacyclin, which protects vessels and prevents clots, which can create an imbalance that may raise blood pressure, cause fluid retention, and slightly increase the risk of heart attack or stroke due to clot formation. But this pathway is mainly a worry with long-term or high-dose use, especially if you have heart disease, high blood pressure, or other risks like smoking or diabetes. So in summary, the bleeding concern is more immediate with acute use of ibuprofen, whereas the increased blood pressure, clotting risk for stroke and heart attack is more of a risk with long-term use. But if you're concerned, this should always be a discussion between you and your healthcare provider, and alternatives like acetaminophen or other medications might be better for your pain management. The other organ that we need to talk about is the second largest organ of the human body, called the liver. And you can see this here, and it is just quite the massive organ. I sometimes refer to the liver as the most unselfish organ in the human body, because the liver sometimes takes a beating from the substances we ingest, including certain medications. But does ibuprofen harm the liver? Well, as the ibuprofen circulates throughout the body, it will repeatedly pass through the liver. And as more and more of the medication passes through the liver has enzymes that will convert it into an inactive form. And we often refer to the inactive forms of medications as metabolites. Now, sometimes this conversion process can result in damage to the liver, and even the metabolite itself could potentially be harmful to the liver and even other tissues throughout the body. We see this with things like alcohol and to a lesser extent with Tylenol. However, the inactivated form of ibuprofen, or the metabolite of ibuprofen, is not harmful to the liver or any other organs throughout the body, and will eventually just pass through the kidneys and be released in the urine. Now, some of you might be thinking, wait a minute, Jonathan, you just previously told us that ibuprofen can be potentially harmful to the kidneys. But that was the active form of ibuprofen, suppressing the prostaglandins, which resulted in the vasoconstriction of the blood vessels in the kidney. However, the inactivated metabolite itself doesn't cause any direct harm as it passes through the kidneys and into the urine. Now, that doesn't cover every single potential side effect, but that covers the main ones. Also keep in mind there are multiple other NSAIDs out there like Aleve, also known as naproxen, that can have some minor differences in how they inhibit enzymes and their potential side effects, but overall they work in a very similar way. But because ibuprofen is the common one used, we decided to focus on that one today. So hopefully this gave you some useful information on how this medication works. Thank you for supporting and watching our channel, and we'll see you in the next video.